The majority of my EHR experience has been in the hospital setting. There's been a little bit in private practice as well, outpatient clinics. I've seen 9 different systems in various stages of implementation and integration. My personal experience has been that it's improved my learning because I have access to more information more quickly. It's easier to find than flipping through a paper chart. I grew up on computers. Um, and so it's a more familiar system for me. It's also easier to understand what other people have put into patients' charts, as opposed to trying to interpret the handwriting of other folks. So it's generally been a very positive experience for me as a student learning on EHRs. I do think that we have a distinct advantage over those that don't have an EHR training. The reason being that the world operates in technology now, and it's not going to change. It's only going to refine and continue to progress in that path. And so you you kind of can only fight it for so long. And the fact is, I may not be as great of a clinician at this point in my training, but if I understand the broader scope of how practice is managed and run now, it's going to help. It's going to put me at that distinct advantage in terms of um, accessing information that I need, sending information I need to send, billing in the modern system, and maximizing my income potential and things like that. So I think it does give me that distinct advantage. I did 8 weeks of rotations in a little town called Lake City, Colorado, which is a phenomenal little clinic in a beautiful little town that's an hour and a half from the nearest hospital. And they have uh, uh, an EHR they set up um, that, and they also have electronic access and secure access into that hospital's record system, as well, especially into their radiology system, because they have to send a lot of folks up there for radiology. And the fact is, they're able to communicate so fluidly between those two programs, between the clinic and the hospital. Um, you know, we will get we will get our CT scan readings back before the patient actually makes it back to town from getting the CT scan. And so I remember seeing a patient that we sent them up. They came back. We had already examined the reports before they got back and came into the clinic, and were able to talk to them about it. Um, so that's a phenomenal example of how technology can really benefit in the transfer of information and things like that. So as a rural setting, I can't imagine being without it.